and talk about really where we're going with personal health records, simply because in the United Kingdom, where I'm from, there is very little experience of these records, personal health records, and therefore little evidence of their impact, although internationally there is emerging evidence in this area. I thought it would be more helpful, given the mixture of disciplines here, to just have a few thoughts about where we're going, what we've seen, where are the failures, where are the successes, and what's coming next that we ought to prepare for. So particularly I wanted to think about how notions of the personal are changing, what we mean by personal and the personalization in this. It's very complex. We're looking at a world, there's huge intersecting policy agendas, all the health agendas around aging, chronic disease, cost containment, you name it. They're all at work, including the cross-border healthcare. And likewise, up against this is the innovation agenda for growing more and more technologies, trying to generate wealth and so forth. And these are all part of the digital agenda, as you know, and there are some questions about how well aligned they are. In fact, can you achieve necessarily one with achieving the others? We hope so, but it's not perfect yet. But one of those main agendas was around giving patients access to their health records, and you wouldn't think that would be such a hard thing to do, but actually it's been quite a lot harder than everybody thought. But before I get there, I want to think about all these P's that are out there just now. They're confusing everybody. They're confusing me. Personal health records, personalized and predictive medicine, precision medicine, personalized health devices, participative health, and the list goes on. And so I'm going to return to the letter P throughout this. So let's think first of all about this idea of getting access to your data, unleashing the data stored in the silos of institutions. That's been a challenge, and they've evolved over the years, really, from the models, and we're still seeing many PHR, which is simply a window into a provider's health record in their surgery or online. Quite basic, and they become more and more sophisticated, more and more integrated, more and more interactive, and some of them are now allowing us to share information from our own devices. Now, we've also talked about a new generation of instrumented PHR, in which there's a little bit more analytics going on under the bonnet. And potentially there is a scope for genomic PHR, and I'll come to that towards the end when I talk about some of the innovations there. And I think just hold that thought for now, because I haven't got much time. Huge variation across Europe, as I said. I'm looking forward to seeing the results. I haven't been able to find it of this sustained project across European countries, various pilots, some positive stories, some interesting qualitative results on what people have had to do in order to make this thing happen. Some people have had to change their laws, or they've changed the way they've done things. So it's been a socio-technical phenomenon as much as a technological one, and there are issues there that were picked up earlier today. So what are the benefits everyone was expecting? Patient satisfaction will be better. People will be more empowered and take control of their health care. They'll do more of the things they're supposed to do to keep well. Communication will improve, and we'll all have better relationships with our clinicians. The accuracy of the records will improve, and we'll trust our health providers more. And as a consequence of all of these things, harm will go down, and there'll be less litigation. Everyone will win. That's the theory. There's a slight inconvenient evidence gap at the moment, and that partly reflects the different evidence contexts. A lot of this evidence is studies are coming from the United States, not so much in Europe, a few appearing. But the punchline of this is that there have been lots and lots of studies looking at different portals, different patient health records, depending on what you want to call them. And there are some qualitative benefits. There are benefits in soft outcomes, process benefits, satisfaction, increased evidence of people giving preventive reminders, these sorts of things, but very little hard evidence on medical outcomes. But I don't think we should be too surprised and despondent by that, because it may just mean that there haven't been enough large trials that are powered to look at that sort of thing. And also, it can take a long time before these sort of proximal changes actually lead to some improvement in a hard clinical outcome. So it's not really realistic to expect that. But some of the proxies are quite positive, but still quite a lot of skepticism out there in the world of evidence-based medicine. And a lot of people have talked about the risks of these things too. What could go wrong? What if I have access to my medical record, but I'm being coerced by someone else that's got hold of my passport or that doesn't want me to have any movement? And they want access to my personal health record too. Where is my sense of control there? Where is my sense of privacy? It can all go out the window. The other people have talked about psychological harm. You know, if you see something in your record that reminds you of something that went wrong in the past, or you might see a diagnosis that you previously didn't realize you had, will this be distressing to you? That's a possible issue. But more importantly, people are worried about discrimination. As you free the data, insurance companies and other businesses can get hold of it. So those are the sorts of things people have talked about. Not substantiated, I'm very glad to say, but something we should bear in mind. So why are these things working, not working? I think, well, we need to understand the why, when, who, and what questions, not simply, is this thing implemented? And there are huge challenges out there, and not least for the industry. If even Google, with all its money and power, failed to deliver a personal health record system, what hope is there for small companies trying to break into this market? It's not quite so simple, is it? And likewise, we even find down at the Mayo Clinic, where they've got this advanced, superb version of a personal health record, only 5% of patients actually use it. So they have to constantly, and likewise governments elsewhere, justify it, say, well, oh, there is value there, even though actually the usage is small. And this creates a challenge for investment, I think. But one of the difficulties, this has been unpicked to some large degree, and one of the questions is, well, who's going to just look at a static record? That's interesting sometimes. You might have a long-term condition. You might be in an acute episode of care, which you have a high information need. But generally, probably most people are not that interested in just looking at stuff. They want things that can help them. Can it help them manage their health and the health of people in their families? Can it help them make appointments? Will it save them money on their health insurance bill, their next doctor visit? Can it help them to automatically fill a prescription? Those are the things that people want. So they want much more interactivity. This is just getting this theme of getting under the bonnet. Some of the examples, I'm just going to give you a couple in the UK, of fairly successful systems have tried to break down who their users are, what they use it for, how often they use it for, just to understand a little bit about who their market is. And this one is for renal patients, and not surprisingly, since they have to go and get dialysis, they're very motivated. They could die, and they're really motivated. It's been very successful. In general practice, there has been a great struggle of enthusiasts often writing their own software to make this happen. It hasn't come from the government telling them what to do. And still they've had resistance for years. Here's an enthusiast that spends all of his time training his patients on these systems. And he's broken it down as well. And not surprisingly, you find it's around diabetes patients, people with high requirements for data and information. But the secret, he's saying, is all about the trusted relationships. It's not about the data. It's about training the patients to be good participants in healthcare. And I think that is the crucial thing here. So that brings me to this question of what is the value beyond the money, okay, and beyond the health out, lives saved, societal value. We have in this agenda around digital human rights. We have a human right to see our data. We have a human right to have our data controlled, protected by us. Someone's here saying, give me my damn data. People want it. It's not fair that it's held by organizations. There's also a personal responsibility agenda there. There's an agenda around making our governments and our health providers accountable. We want to see what they know about us to check whether it's true. And digital society and access to services. Those interactive PHR should give us that. So I've mentioned some of these success factors that have been discussed in the literature and through various interviews with people using these services. I won't go into all of them, but it's around trust, respect, information, and education. And an important part of this, if you're thinking about the value of these systems, is to say, well, actually, they can improve trust in the entire enterprise of healthcare. Not only in your delivery of care, we know that there's huge mistrust sometimes of governments, there's mistrust of people's handling of your data, but if you can see it yourself, you're going to be slightly less worried about that. And likewise, trust in research, I think, is a great possibility in this area. We're using people's data, we're using them as data subjects, but really, if they feel more confident about what is held about them, who's getting to see it, they will feel a lot better. That's the phone, I think, telling me off. But we have to keep up with innovations as well. We've had all this hard time just opening the lock to the sort of the filing cabinet, and that's only part of the thing. We have to keep up with the innovations. We're slow to adopt as health organizations. We're maybe stuck in yesterday's eHealth. The digital society is overtaking us. So what's going on out there? Well, we've got all the personal technology ecosystems. People are buying this stuff outside of their clinicians' knowledge and control very often. Some enterprising health systems and some good PHR are importing this data and allowing that to inform clinical decision making. But typically it's happening out there. We hope, I mean, obviously this is the mobiles and the wearables, the Internet of Things, we've got digital concierges, assistive robots, all of this stuff, you only have to open the newspaper, the technology pages to see it. And I see these personal and provider ecosystems, they're going to be forced to merge in due course. And if they don't, I think we're in a bit of trouble. And we've also got innovations there. If you talk about internalizing sort of values and ideas, we're internalizing the personal data ecosystem as well. Pretty soon our contact lenses and our false teeth and our pills are going to be telling things about our medicine and our healthcare, and they're going to need to go somewhere. We're going to want that data, aren't we, if we paid for that? And also the researchers and the health professionals working with us are too. And something else that comes up in this PE world is around the personalized, people's engagement with research as participants, sometimes as the people who are actually generating the research. And for that, they also need these personal data platforms too. Increasingly, the drug companies have got wind of the fact that if they have mobile platforms and apps and websites, they can recruit larger numbers of people than they ever could before. They can track their outcomes in real time. They can get real, genuine, patient-generated data. So quality of data is going up, potentially. This is all new, but it's happening. Recruitment is going up. Apple HealthKit is the obvious one that's disrupted the market, but all of these other guys are doing it as well. So we are all part of the same enterprise. It's no longer going to be them and us anymore. And likewise with patient-led research, collaboratives coming together to set the agenda for the research, to run the research and to analyze the research. Although there's a little flipping there, I see patients like me being flipped over to a commercial organization where the patients are becoming a kind of fodder for the industry, which I don't like very much, but maybe I don't know enough about it. And of course, we move on to personalized medicine. If you've looked in any, I don't know if you have it here in Italy, but if you go in London in the tube, or you turn on any cable television channel, there's all these advertisements for testing your genetic profile, 23andMe. Come and get yourself tested. Oh, it's fantastic what we can learn about you. Increasingly, companies wanting to evaluate your microbiome and genetically test what's going on inside your guts. And this is all presented to people like this great, wonderful bag of sort of magic. It's going to make them very happy and entertained and help their healthcare. But there is a dark side to it too, because we don't really know who's got hold of that data and what they potentially could do about it to us. But this is coming, and people are storing these in their personal data stores. Okay, this is going to need to integrate, especially if the medics are going to genuinely fulfill the promise of personalized medicine. They're going to need to engage with the personalized medicine we create ourselves. There are issues here. I've called it crowdsploitation, mainly because some of these companies are advertising themselves as they're basically using the population to gather data for their own research, but charging them for it, which seems a bit strange. And likewise, out there, we've got all of our data trails, our social media, all the big data that's gathered about us from our prescriptions we pick up or our interactions with various services, all types of societal data. I'm involved in administrative data research as well. There's all sorts of governmental data and other sorts of business data and social media data, all becoming to be drawn together. And that is also part of our personal world. And personal data stores are beginning to accommodate all of those types of data. So why not healthcare too? Questions are, whose data are they? Obviously, there's philosophical questions. There's another P I thought I'd put in. Am I my data? Some people say so. There's a concept of embodiment of data. And ultimately, though, it comes down to another P. It's the person, understanding them. It doesn't matter what technological solution you have. They may be very different. They may be designed for different groups. But we have to understand that within each group, there are subgroups and subgroups and subgroups. We're all different. Our illnesses may be at a different stage. So a system is designed for diabetes may have very different manifestations in one group than another. The health systems may be different. Cultures may be different. Italy versus Norway, for example, very different cultures, very different expectations. For example, around the integration of the family in the personal health record. That's really interesting to me. In the UK, it's all individualized, very American, whereas in other parts of the world, it's much more of a focus around the family. And this has implications for information governance, and likewise, our personalities and our trustworthiness in data. So finally, I'll just conclude to say that technology innovation and societal demands are outpacing our health systems. Understanding the EMR from the person perspective is vital if we're going to advance and accommodate this sort of innovation. And although genomic and data sciences are developing rapidly, policies, professions, processes, and platforms have to adapt too. And to do this successfully, we need to be interdisciplinary and intersectoral and collaborative. So I'm just stop there. Thank you.